Hey, you guys, welcome back for day 6 of our practice question series. This week we have been covering endocrine, GI, renal, and neurology. Let's get into today's questions. Question number 1 states a patient presents to the office for follow up today. The patient states that she has noticed recent weight gain to her face and abdomen. She shows the nurse practitioner a purple stretch marks to her stomach. As the nurse practitioner documents her assessment, she notes a moon shaped appearance to her face, abdominal weight gain with purple striae, and Hirschism. Based on these findings, what is the best differential diagnosis? Is it A, hyperthyroidism, B, Addison's disease, C, Cushing's disease, or D, hyperglycemia? Now take a minute and tell me what you think in the comments. All right, as always, I tell you guys to read the stem of the question first to ensure that you're answering what is truly being asked. So the stem of the question states, based on these findings, what is the best differential diagnosis? So if you take it back to see what is even presented to you, the patient comes in stating that she's noticing weight gain to her face and abdomen, solely talking about these areas, noticing stretch marks to the abdomen as well. The nurse practitioner notes on her assessment the moon shaped appearance of her face, the abdominal weight gain, the purple striae, the Hirschism. And so you need to think of what are these classic presentation of hyperthyroidism. You do have several symptoms, but when we think about hyperthyroidism, I always tell you guys think of how you're running. Think hyper. You're racing. You have tachycardia with that heart racing. You have weight loss because the metabolism is overactive, right? So not weight gain. So you can eliminate that, right? Addison disease, potentially, but that's more so also more similar to the hyperthyroidism. Cushing's disease, this is classic symptoms. That purple striae, that moon face appearance, that moon shaped appearance to the face, along with the buffalo hump, is something else that are key identifiers. Hirschism is a key identifier. So, I always tell y'all to know those key. It's because they're going to, when they test you, they're going to point out those things because they want to ensure that you're able to identify things that you can commonly see in practice at the most textbooks level, right? So the best answer is C, Cushing's disease. All right, question number 2. The nurse practitioner diagnosed Mr. Smith with acute pyelonephritis. She is explaining to the nurse practitioner student a good treatment option about good treatment options. What shows appropriate knowledge? Is it A, amoxicillin for 5 days, B, Cipro BID for 7 to 14 days, C, amoxicillin BID for 3 days, or D, Cipro for 3 days? Tell me what you think in the comments. All right, so the stem of the question states, what shows appropriate knowledge? So we're talking about treatment for acute pyelonephritis. So when you hit this stage, for one, this is beyond the complicated stage of UTIs, right? So we know that we are treating more in that 7 to 10 window. So instantly, if you didn't know anything else, the duration of the treatment in B should have warned you to go there. But Cipro and Augmentin are classic treatment options for acute pyelonephritis with the ciprofloxacin twice a day for 7 to 14 days is your best answer choice for this one. All right, question number 3. The nurse practitioner student is trying to read the hepatitis panel. What shows adequate understanding of the following panel results? The HbSAg is positive, the anti-HbS is negative, the IgM is positive. All right, is it A, the patient is positive for acute hepatitis B? B, the patient has immunity to hepatitis B? C, the patient is positive for chronic hepatitis B? Or D, the patient has an acute immunity from a recent vaccination? Take a moment to tell me what you have in the comments. All right, so we're reading the stem of the question first. So, what shows adequate understanding of the following panel results? So, again, we're talking about here the Hep B results. We're trying to see that the nurse practitioner student has a clear understanding. So, it's showing that the hepatitis B surface antigen, so the HbSAg is the surface antigen. I always say the little s, think of that for surface, and the Ag is for antigen, right? And so that's positive, and the anti-HBS is negative. I always tell y'all to look at this because the serology is much longer than this typically. But if you can hone in on those two, you can quickly identify the answer, right? Because if the surface antigen is positive, that means they have it. If the anti-HBs that is positive, that means they have immunity because they are positive for the antibodies, right? So here, the surface antigen is positive, so that means they have the infection. They have the hepatitis B. Then, as you go down more, the IgM is positive. So you think of it, the saying M for minute. So they have it right now at this minute. It's acute. So the best answer choice here would be A, the patient is positive for acute hepatitis B. All right, and the last question for this week is the nurse practitioner has diagnosed a patient with trigeminal neuralgia. What cranial nerve is affected with this diagnosis? Is it A, cranial nerve 2, B, cranial nerve 5, C, cranial nerve 11, or D, cranial nerve 8? Take a moment, tell me what you have in the comments. All right, so the stem of the question states what cranial nerve is affected with this diagnosis. So when you're thinking about trigeminal neuralgia, thinking about the location of what is affected here, right? And so in that zone, in that temple region, that's commonly affected, I'll try to put up an image so you can see it, but it is cranial nerve 5 that is affected here for trigeminal neuralgia. Again, make sure you are familiar with those diagnoses and the areas that the cranial nerves affect so that you can quickly identify answers like this. All right, you guys, as always, be sure to like, comment, subscribe, and share with whomever may find this beneficial. But be sure that you meet me back here. This concludes the one for this week, but you know that we're doing this practice question series all month long. So next Tuesday, Wednesday, Thursday, we will be covering dermatology questions, musculoskeletal, STDs, as well as men's health. And we'll keep this series going. All right, meet me back here. Bye, y'all.